My name is Susie Finnerty. I am a resident of Providence, just around the corner. I have been practicing as a doula since 2014, and I am co-president of the Doulas of Rhode Island, which is our local professional organization for our state. I am here in support of the Senate Bill 0678, introduced by Senator Anna Quezada, that would require all health insurers, including Medicaid, to cover doula services. The foundation of this bill has rested on the widely accepted data that when people have access to a doula, they are less likely to have a surgical birth, less likely to require medication for pain, or to speed labor along, an increase in satisfaction with their birth experience, and an overall shorter labor. There is a well-documented decrease in premature births and newborn illness. These are important when discussing the cost saving in maternity care and in saving lives. We have heard stories from the beautiful people here today as to how that is meaningful in their lives and their patients' lives, and for their safety and to their families. For me as a doula and a leader in that community, and the provider for my family, I cannot stress enough the importance of funding this care well. Rhode Island will not see the outcomes that these statistics boast if doulas cannot afford to work. Last night, I worked from 12 a.m. to 8 a.m. with about an hour's notice, and today I cared for my 3 children. My middle child is behind me somewhere. I will follow this family at their home when they are discharged on Saturday and support them postpartum as they have no local family. They will not be followed by a medical provider for another 6 weeks, which is the current standard of care. I will be the eyes and ears, making sure they are okay. And I charge a full and fair wage for these services. When we are compensated well, we are able to provide the uninterrupted presence following the family prenatally to their place of birth and at home. Families who can pay for a doula services are working to make this investment in their care, and families who cannot afford care deserve evidence-based options available to them by their insurance. Our organization has been approached several times by the community members, doctors, and midwives to support their families at no compensation who desperately need the support. This isn't right and it isn't sustainable. And it is often said that if a doula were a drug, it would be unethical not to use it. I think if there was a pill with this evidence, we wouldn't even be here today. It would just be widely prescribed. And so that's why I'm asking everybody to move this bill forward.
Any questions? Yes.
So I just wanted to ask you my previous question. You said that you would be there for how long? So you'd begin when the birthing process begins. How long on the follow-up?
So I start supporting a family when they hire me. Some families call the minute they pee on a stick. Some families wait until their water breaks. Ideally, we have some time prenatally to meet with them in their home, get to know them, understand their wishes. I work in a group practice that also follows people in a group for group prenatals. And we are on call for them 24/7 for when they go into labor. Typically, this starts at 38 weeks. Every doula does it a little differently, but people will call us if they go into labor earlier. And we stay until their baby's born and a few hours after to help make sure that breastfeeding is established. And we also make sure that they kind of have an immediate plan for care, practical stuff like when are you going to sleep with your 10 visitors that you have planned, and kind of triaging those types of practical things. And then some families, so my standard is that I would come to their home one time postpartum, usually the day after they get home from the hospital. Some families will contract with me for an extended period, and it just kind of depends on what the family needs. So it really looks differently for each family. The postpartum period for doula care is sort of generally understood as the first 3 months and then can extend up to a year. And that includes if there is a loss or if the pregnancy does not end in a birth.
thank you. I really appreciate you educating us about the process of being a doula and coming to testify. And I'm curious just because I don't know this part of it. So if the child ends up in the NICU or an extended period of time in the hospital, what is usually the doula's role at that time?
Making sure that the family's like okay. You know, the hospital staff they should have the safety piece under control. We don't always see that, but ideally that's happening. So, you know, making sure that mom is like medically okay. You know, having one of my kids personally was born needing medical care, and you're just not okay when that happens. So we are checking in with them if we're not there still. So I've had, like, if there's a family and they have a baby go to the NICU immediately, I will typically stay with mom while the partner follows the baby, and we just kind of stay until something resolves, you know, whether they have like a plan and they're reunited somehow. But we're kind of in constant text and phone contact, setting up supports for at home, what's going on with siblings. Does that answer your question? Yeah. I'll also say that this has been an ongoing discussion in the wider doula community, that oftentimes, especially people who have had premature births, or just a regular delivery, are not being sent home with adequate feeding instructions. So we're catching a lot of like dehydrated little babies, making sure that people know how to count diapers, making sure that baby is like fed enough. And you get a folder of information when you leave, but you've just been through so much. So we sort of help people kind of sort all that out.